This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, senior attending here at the center.
And I'm Dr. Alara, research fellow. Today we're looking at a fascinating new study from the journal Clinical Lung Cancer, published in 2026.
Now, Alara, before we dive in, some of our listeners might wonder why a neurosurgery podcast is covering a study titled Pretreatment SUVmax Stratifies the Benefit of Consecutive Daily SBRT in Early-Stage Non-Small Cell Lung Cancer. But as we know, the principles of stereotactic body radiotherapy, or SBRT, are the bedrock of what we do in radiosurgery, whether we are treating the brain or the body. The radiobiology of dose fractionation and treatment timing is universal.
Exactly, Dr. Aris. And this paper focuses on a very specific clinical question, the prognostic value of pretreatment SUVmax in early-stage NSCLC, and whether that metabolic activity actually modulates the impact of overall treatment time, or OTT, on patient outcomes.
It's an interesting variable to isolate. We often talk about the physical dose, but the biological aggressiveness, measured here by the SUVmax on a PET scan, might dictate how the tumor responds to the timing of that dose. What was the primary objective of the researchers here?
The team set out to investigate if pretreatment SUVmax could be used to stratify the benefit of consecutive daily SBRT. In many centers, we debate whether it's better to deliver these high-dose fractions back-to-back or to allow for a day or two of rest between treatments. This study suggests that the metabolic activity of the tumor essentially determines how much the treatment schedule matters.
Let's break down that term for the residents, SUVmax. We're looking at the maximum standardized uptake value. In the context of this study, it's serving as a surrogate for metabolic intensity. Dr. Alara, how did they find that SUVmax influenced the outcomes regarding overall treatment time?
The study found that pretreatment SUVmax effectively stratifies the benefit of consecutive daily SBRT. Specifically, they looked at how metabolic activity modulates the impact of OTT. If a tumor has high metabolic activity, the speed at which you deliver the total dose, the consecutive nature of the SBRT, becomes a much more critical factor in the prognosis.
That makes sense from a radiobiological perspective. A more metabolically active tumor might have faster repopulation rates. If you prolong the overall treatment time, you might be giving a fast-growing tumor breathing room, so to speak. Did the paper specify how they evaluated these outcomes?
They focused on evaluating whether metabolic activity modulates the impact of OTT on specific outcomes. The core finding was that for patients with certain SUVmax profiles, the consecutive daily approach provided a distinct advantage. If you didn't account for the SUVmax, the impact of treatment timing might seem less clear. But once you stratify by that pretreatment metabolic signal, the benefit of shorter consecutive OTT becomes apparent.
This is a crucial takeaway for our practicing neurosurgeons and radiation oncologists. We often treat early-stage lesions with SBRT thinking the dose is the only thing that matters. But this 2026 data suggests we need to be looking at the pretreatment PET scan very closely. If we see a high SUVmax, we shouldn't be skipping days between fractions.
Precisely. The paper concludes that pretreatment SUVmax is a significant prognostic value. It doesn't just tell you if the patient will do well or poorly in general, it actually helps the clinician decide how to schedule the SBRT. It moves us toward a more personalized approach to radiotherapy.
It's about the stratification of benefit. If the metabolic activity is high, the benefit of consecutive daily SBRT is maximized. For those with lower SUVmax, perhaps the overall treatment time is a less sensitive variable.
Right. And for the medical students listening, remember that overall treatment time, or OTT, is the duration from the first fraction to the last. This study shows that in early-stage NSCLC, we can't ignore the metabolic personality of the tumor when deciding that time frame.
Fascinating work. It reinforces that in the era of advanced imaging, we have more tools than just tumor size or stage. We have metabolic data that can and should influence our stereotactic treatment planning.
It certainly does. It's a great reminder that the S in SBRT or SRS isn't just about spatial precision, but increasingly about biological precision.
Well said, Dr. Alara. That's all the time we have for today's deep dive. Thank you for joining us on the Neurosurgery Hub podcast. See you next time.